us who are listening who might be leaders or will be working with our leaders in our individual schools, these are very important key takeaways. How do we allay the fears or the anxiety that first and foremost the teachers are coming with? Because if the teachers are grounded, then they can support the students. So you might not be able to talk to all the students, but if we help the teachers understand the situation, then you have an army to help deal with the situation on the ground. And so that takes us actually to the next conversation. We want to dig in a little bit. So we've talked about, we know that part of the protection, the golden rules that come with COVID issues to do with social distancing and putting on of masks and washing of hands or sanitizing. And we just want to hear a little bit, very briefly, how these particular measures have been successfully implemented. What are some of the successes you're celebrating? What are some of the challenges that you may have faced at the beginning? And if you are no longer facing them, how did you turn that around? So again, I'm going to go back to Rebecca, who, having been in school for 1 week, is still feeling really okay. Things sound good. But could you tell us a little bit about the issue around social distancing, the issues around masks, the issues around washing of hands? How is that playing around for teachers and for students? Are you guys succeeding in honoring those rules, or are you having struggles in any way in following those rules? Rebecca.
Okay, so talk of the safety mechanisms. The thing is that the Ghana Education Service has done really well by providing us with everything we need. So my school, for example, has hand washing buckets at all entry points. And so once the child enters, whether a child or a teacher, you wash your hand first, then your temperature is taken and recorded, much like building a dossier on every individual on the school campus, so that if there is any change, it can be detected early and then measures can be taken. And with the issue of social distancing, our class sizes have reduced drastically. Desks are arranged 1 meter apart, and the timetable is also such that teacher doesn't report to school if he or she has no lesson. That's where we have little or no time at all to even chat with each other unless we close. And like I said earlier, the first day the hand washing didn't really go down well on the part of the children. But as teachers, we took it upon ourselves that every 3 to 5 minutes each day, we are going to educate the children on the new normal protocols, the essence of actually washing their hands and then wearing the nose mask, so that they do not just feel that these are protocols they've been asked to go by. It's something that actually affects their very lives and health, as a matter of fact, and so they will have to live by it, go by it in order to survive. And it's going well. Day 2, we realized that there was a bit of discipline. Subsequently, day 3, 4, and 5, there was high discipline. At least if for out of every 10 pupils, we're having like 8 of them. They just walk in, you don't tell them to wash their hands, and they'll go straight to the washing hand bucket and do the washing of hands themselves. And so far, it's been good. The system is running smoothly. And in Ghana here too, the SHS senior high school students went to school a week before us. And talks with some of their teachers reveal that they are doing well with the washing of hands. The wearing of nose masks hasn't been all that easy with the children, but then they are managing. They are trying to encourage the children to wear the nose mask, even though it's so uncomfortable.
Thank you, Rebecca. So some very pertinent point there that you have been provided with the water that you need. There are washing points. There's a protocol that people have to follow in terms of coming in. I think one of the things that we've talked about that is very interesting is that teachers' arrival at school is now pegged to the timetable, and that one of the things you are actually implementing is that there's very minimal interaction of teachers amongst themselves. I think the last time we were speaking.
Harry?
Yes.
Hello. Harry.
Yes. Yes.
I just saw in the chat someone was asking about the boarding schools in Ghana, how the social distancing is going with them. And it's similar in the boarding schools. You know, those schools who were operating day and boarding, the government decided that the day students actually be converted to boarders. And so they are all staying in the schools. And when their dormitories have been spaced out, their beds spaced out 1 meter apart from each other. But, you know, the children, it's a bit difficult when the 15 minutes break is in session, that they shouldn't play with each other and all that. You realize that inadvertently they are all together playing, but we keep reminding them that they should be a meter apart from each other.
Thank you, Rebecca. So thank you for that add-on, because boarding schools is a reality in most of our African countries, and so how that is going to play around for boarding schools vis-a-vis day schools. And I think the unique one which you've talked about is when you have day schools and boarding schools. And what you're saying your government has done is that it has turned everybody to be a boarder. I wonder what that means in terms of fees and resources that are required, but we can have that conversation later. And as you said, there's minimal interaction amongst teachers. Teachers just come into their class and walk from one lesson to another and try not to hang out with each other too much. It seems, however, that teachers are on duty through and through, because even during break time, you're having an eye on the kids to ensure that they are not violating the set protocols for 1 meter social distance. And then you have said you've also tried to space out the students. Perhaps we'll come back to that conversation. So where are the other students? Do you have more teachers attending to them? Do they come on different days? But we'll come back to that conversation. Let's go down to South Africa and hear about, again, a public school before we come to private school. Yani, how has things been about masks and social distancing and washing of hands? How well has that worked? And what, if it has worked well, what are some of the things that has contributed to it working well? And if there have been problems, what are some of those problems?
Okay, so I'd say from looking at the general picture, so not just my school, the general picture in schools across the country is that I think we're trying our best. So we are there on the front line. We are reminding the kids about the masks. We are trying to social distance. But one of the things I think I found at school, and I think I've heard as well, is that, you know, it's almost human nature to, you know, somehow find yourself maybe not a 1.5 meter distance from someone. You might be talking and you might forget, or, you know, you want to instinctively just want to connect and touch people. And it's a bit awkward, I guess, in that regard. But we have sanitizing stations, we have sanitizers in each class, in all the classrooms we're supposed to have. So we're mandated by the government to have at least one bottle of sanitizer in each classroom. Classrooms must be sanitized, you know, after break and all these things. And I'd say on the front of watching the kids actually, you know, trying to implement the guidelines and the safety measures, we are trying. But what, you know, becomes evident is that sometimes, you know, some of those things don't work, because we are expected to be at school for, I think it's 8 hours. It's almost 8 hours. So we must serve our 8 hours at school. we have to be there, even the people who haven't been teaching. So we have only, I think at the moment, up until Monday, we have grades 12 in high school, and then primary schools have grade 7s. So we only have one grade. So there are people who aren't teaching, and they are expected to be there. And one of the impossibilities has been that in certain schools, especially the Black public schools, one of the issues we have is that we don't have spaces to sit, and it's winter. And now we found ourselves in places together, maybe, not wanting to be there, but we don't have a choice. There's nowhere else to be. The other option is to be outside, facing the elements, which I don't think, is very dignified and, okay. Because besides the cold, I mean, how are you supposed to eat your food? So small things like that. And I think ultimately all of these things, these small things kind of build up to undermine all the kind of safety measures that are in place. For example, I saw my colleagues marking books in the staff room. They'd bring the books down, sit in the staff room, and maybe they'd leave and someone else might sit there, unknowingly, touch that thing. So I think that's maybe one of the reasons why the virus is spreading in our schools. So I also caught the virus. I tested positive. I think a week ago, and it's then to try and be like, what else can I do to kind of keep everyone safe? If it's not to check books, if it's not to kind of engage directly, what else are we supposed to do? I don't know if you know what I mean, but we're trying. The social distancing is there, the tape is down, and the markers are down. The stations, the sanitizers are available, but sometimes it also feels like these things are not going to be enough in a society where I guess the community transmission has reached the level it has reached.
Thank you,
I don't know
Rebecca.
if I've answered.
Thank you, Rebecca, for presenting that. And I think Rebecca has presented a very personal dimension to that actually, I think last week she was out of school, she was unwell, and when she went for the test, she actually found that she had actually coronavirus had actually caught up with her. But we are happy that she was able to fight it out, and she's here with us today. So I think the reality is that some of these things will happen. And as you say, the challenge of space is something to think about. And now you're saying in this particular case, you have only 2 classes who have since reported. We'll be talking about whether they come, if the whole class comes every day or what. But just, I think if those of us who are perhaps look at news, I think on 23rd of June, there was a reality of around 180 learners in one of the senior secondary schools in Eastern Cape having contracted or tested positive to coronavirus. And I think later Sandra shared with me around 300 schools had to be closed down again because of coronavirus. I think Sahib, who has not been able to join us, we were talking last week on Friday and on Wednesday, and he actually indicated to us that he was not going to go to school on Thursday because one of their teachers had contracted coronavirus, and they got a message in the evening, don't come back to school tomorrow because they had to do some cleanup measures. So this is just to tell us that this, so long as the pandemic is still going to be around with us, the susceptibility or the reality that the infection might happen, because even though we try to adhere to the rules, sometimes there are circumstances that might make it not possible to adhere to them 100%. Let's go down to the private school. How is it working out with masks? And especially you're teaching the younger children. They are perhaps grade 2 and below. How is that coming up with social distancing and putting on masks? Sandra.
So on my side, I'll comment on my side in my experience. So with us, social distance is being strictly observed, but the kids still have that excitement. You know, kids have been out of school for a long time, and they've missed their friends, you know, that excitement. They want to touch each other and they want to hug their friends and catch up. But then it's unfortunate that we need to strictly keep them at a distance and teach them also how to maintain that distance. So our classrooms have been set up in a manner where social distancing is a must, you know, and it's quite challenging for them to be seen crossing over, because it's pretty obvious for them to be seen crossing over from their own desk to the friend's desk. And that already immediately raises an alarm to you as a teacher to immediately intervene. So I have noticed that the smaller kids are still struggling with the use of mask. You get comments like, "Teacher, I can't breathe properly. Teacher, I need to breathe a little bit. This mask is too tight. My ears are painful," and you know, such stuff. So what we've incorporated now is that our head, Melissa Venter, brought up a system whereby after every period we introduce a 15-minute break. We call it a breathing moment, where kids are allowed to take off the mask and breathe, but they go outside and they're still expected to maintain their social distance as they do that. Because, you know, once the masks are off, kids want to start talking. So they still have to maintain their social distancing, even when it comes to break times where they have to eat their food. Because we are only having one grade a day, for instance, not all kids are coming into class. Because we're still offering both online and contact classes. So some parents are still skeptical about bringing kids into campus, and some, of course, having the challenges of transport and bringing their kids over. So we're only having a few at the moment coming into campus. So it's quite manageable, because we have teachers, only grade 2 teachers, our head, present there for the day, as well as the assistant teacher and the other cleaning staff in. So they are quite helpful, because we work as a team to make sure that we give each other certain roles that we have to adhere to make sure that the kids are safe. The cleaners are there monitoring how kids are going through for recess in the bathrooms, and making sure that they all don't go at a go. It's one child in, comes out, then the next one follows. So that helps in, and sanitizers have been put in place in every classroom. And fortunate enough, for most of the kids that are coming into campus, the parents have managed to pack in the small pocket sanitizers for them. So this makes them aware that every time they're out and when they come in, they need to use their sanitizers. So for that, it is really helpful.
Sorry, Sandra, we are... Move closer, we can't hear you.
Oh, okay. So I am saying it's fortunate enough that most of the parents that are having kids coming into campus for contact lessons have also managed to pay in pocket sanitizers for their kids. So they've already been taught what is expected from them from home. And then we also make sure that every day in the morning before they go into class, soon after being tested, our head assembles them, where she addresses the expectations for the day and gives them a reminder, because remember, these kids are only coming once a week. So every time they're coming in once a week, they are told what is expected to them, and we've tried to make it fun for them and at the same time educating them. For instance, our grade 2 pupils, we've taught them you're expected to wash your hands for 20 seconds, and you know, a grade 2 student doesn't know what 20 seconds means or what 20 seconds is. So our head came up with a concept whereby for you to know that you've washed your hands for 20 seconds, you just sing happy birthday. By the time it's finished 2 times, then your 20 seconds is up, then you go back to class. So that becomes quite exciting for them, because every time they go into the bathroom and they have to wash their hands, they remember I have to sing, and I have to sing as much until it ends, then my 20 seconds is up, then I'm going back into class. So some of those things, because remember, small minds learn with play. So you need to keep it exciting. They don't want to feel like they're being tightened and restricted. Make it fun, make it exciting, but at the end of the day, drive the point home.
Thank you, Sandra. Thank you. And just where you've ended, and I want to connect it back to what Rebecca said, that at the beginning when the students came in, even though they're at junior high, there was a sense that they were not following the rules as much. But one of the strategies that they have employed in Ghana, which is connecting to what you're saying, is to appeal to the students' conscience, so that it's not just rules being given, but there's a sense of getting them to connect and to understand and appreciate why it is important for them to actually follow. So I think that's really, really important. And the other thing that you've talked about is the collaboration that may have to happen between the school and the parents. How much engaged the parents are going to be in continuously reinforcing in the minds of the students as they leave home, as they come back, in terms of the importance of following this rule, so that the message from the school and the message from the parent, there's consistency in messaging, but at the end of the day, it's not coming out so much as rules, but we're finding ways to connect to the hearts of the students. The third thing that you've talked about, and I think even Yandi talked about, is a teamwork, because Yandi talked about it's not just the teachers who are expected to be in the school. Even the other members of staff have to be in school, and they're the extra eyes and they're the extra ears. And I think now, as we're listening to that, I think we have to ask ourselves the demands that come with that. Because right now we're still talking about not everybody being in school, but there's a sense of teamwork that we're talking about, everybody knowing what role they're supposed to play and positioning themselves so that there's a coordination and there's cohesion in the passing on of the message in a very continuous way, but friendly and engaging way to the students. So I think that's coming out. What's coming out also is that putting on masks is a challenge. It's a challenge, and I believe all of us who have tried it know it. I mean, if we were to do this particular panel right now, all of us in masks, I know it will feel fairly uncomfortable, but we'll come back to ask, I mean, for the teacher, we're coming back to the classroom, how classroom looks like. But I guess one of the things that you've talked about is seeing if one can bring in a breathing break, that students know, okay, I need to persevere because eventually I am going to get time to remove my mask and breathe in for a few minutes. But during that time, there are also restriction of distance so that, again, they are not exposing themselves to infections. But as Yandi said, all these, of course, will work out depending on a number of things. The available spaces in our schools and the structures that have been put in place, because you can have very good rules, but if you don't have the space and the structure to support some of the things. I think Rebecca shared in an initial conversation that their school at the beginning, they have not had water for so long. And so in the first day, they had to think about, we may have to buy water. So some of these things being put in place are very, very important.